Good afternoon, everybody. Welcome to today's session. I want to thank Drs. Erin, Winstanley, and Gloria Miele for presenting for us today. We have several methods in which we can take questions. There is the Q&A feature located at the top of your screen. Once you click on the Q&A, you may go ahead and just type your question in the dialog box right there, and then we'll get a notification that your question is in queue. We'll also ask for questions periodically throughout the presentation. When we do, if you'd like to ask a question, you may press *1, and the operator will open your line for the presenters to hear your question. At this time, I will go ahead and turn things over to Dr. Winstanley. It's all yours.
Thanks, Liz.
You're welcome.
Dr. Gloria Miele and myself, Erin Winstanley, are presenting today's webinar on social media. I want to first thank all of you who joined our social media webinar on January 25th. We had a record-breaking attendance, so thanks so much. During today's webinar, I'm going to be showing you how to set up a Facebook and Twitter account. I'll show you some tips and tricks to optimize your accounts and to help you save some time. Dr. Miele from the Greater New York NIDA CTN node will be discussing how to use social media as a research tool, including how to address IRB or other regulatory concerns. And she'll be sharing with you some preliminary data from the NIDA CTN 44 study, which used social media to follow up with research participants. First, we'll begin by setting up a Facebook account. The first thing you need to do, if you don't already have one, is to create a personal Facebook account. You can see on this screenshot that it requires a minimal amount of information. As you can see on the bottom of the slide, you just click Create a Page button, and you're off and running. Now, if only getting funding for research studies or following up with study participants was as easy as clicking a button. When you personal account, you'll need to choose a page type. Most likely, you'll be choosing either a company, organization, or institution, or a cause or community. As we move through the presentation, I'm going to show you the differences between these two options. You will always log in via your personal account. You can see on the top right-hand corner that a downward-facing arrow can be selected, and this arrow will allow you to switch your view to your different Facebook profiles. You can see that I have administrative privileges for 3 Facebook pages. One, the Ohio Citizen Advocates, the Ohio Valley node of the NIDA CTN, and Souls for Recovery. The OVN is set up as a company, and Souls for Recovery is a community. I'll be showing you the screenshots of each to help you understand the differences between company and community pages. Toggling between these different accounts is easy to do, and I always make sure that I see the correct profile picture before I post to ensure that my work posts are on the OVN account and my personal posts are on my personal Facebook account. For our more advanced users in the audience today, in the page settings, you can click on an option so that you can only post on your page as the page administrator, even when you're browsing the page from your personal Facebook account. You can provide information on your organization by clicking on the Edit Page button. As you can see on the left-hand side of the screen, you would select the Basic Information tab and then enter more details about your company or organization's page. You can insert a brief description. You should include a link to your company or organization's homepage so that people can learn more about your organization. And you can do things like provide transportation instructions, like how to use the bus or subway to travel to your location. And because it's so easy to edit information on Facebook, it may have some advantages over a website. So, for example, if the bus line that travels to your organization is rerouted or changed, you can quickly post instructions with alternative modes of transportation for your clients or customers to see. In the field labeled Place Your Subcategories, as you can see circled on the screen, you can choose your keywords that can be searched within Facebook to find your page. You cannot make up your own keywords. I tried to do it. You actually need to start typing a word, and then a list of possible categories will appear. So for the OVN Facebook page, I have chosen Research Service, University, and Addiction Resources. If you'd like a map to appear, you can just simply click on a button. If you select the map, another screen will open with just the map, which allows you to zoom in or out on the geographic location, and you can even open the map in the web browser Bing so that you can get directions. Because we're going to be talking about Facebook functionalities that vary between Facebook personal accounts, Facebook pages, and Facebook groups, I want to orientate you to some coding that's embedded on some of the slides. So, for example, on this page, you can see that I've used blue bold text on the bottom right-hand corner to indicate that this is a screenshot from a company page. This is a screenshot of the basic information screen for my Facebook page, Sold for Recovery, which was set up as a community page. Community pages cannot provide as much basic information as a company or organization page. So, for example, a community page cannot post an address or search terms or hours of operations. Since Souls for Recovery is a charity team for the Flying Pig Marathon, we don't have a physical address, so these fields are not necessary, so a company page works well for us. If you have a physical location that's important to what you do or what you're promoting on your Facebook page, you probably would not want to set it up as a community. In this case, you're going to want to set up your Facebook page as a company or an organization. You can upload a company picture or logo as your Facebook page profile picture. I like to use logos not just because you're building brand recognition, but because you are also conveying that this is a legitimate Facebook page representing a real company or a real organization. You'll see that some Facebook pages will indicate that they are official pages for a company, musician, or the Hollywood star. When you set up a Facebook page, you'll automatically become the page administrator, which means that you'll have privileges to edit the page content. But you don't have to take on this burden by yourself, right? You can, and you really should, assign alternate page administrators, and this way you can share the work of maintaining the page. The easiest way to assign a Facebook administrator is to first you click on the Insights tab, and then you click on the Likes tab, and then you'll see the screenshot on this slide. I can easily choose who among the fans of this page could be an administrator. Liz Buttrey organizes these NIDA CTN webinars. She's a fan of the OVN Facebook page, and I could make her an administrator of my OVN page so that she can post information on upcoming CCC webinars. This is a good point to also tell you that there's a big difference between friending someone on Facebook and liking a page. I do not have access to individual users' Facebook profiles or walls of fans that like the OVN, unless, of course, if they haven't set any privacy settings, I would be able to access that information. But if you have any privacy settings set up, I wouldn't be considered your friend and therefore cannot access any of your personal information. And I cannot view your news feed for individuals that like our page. Once you've got your basic Facebook page set up, you're going to want to pimp your page, make it look better looking, enhance the functionality, improve the overall utility of your page. There are lots of applications that you can use to enhance your page. Some of these applications are easy to install, while others might require advanced technical knowledge. You might want to consider adding applications to post notes, videos, your LinkedIn profile, your Twitter account, attached documents, event pictures. Applications are accessible on the Facebook page, and they will appear in the left-hand side toolbar. Once you've added or installed these applications, you can manage the settings within your Edit Page button. If you're having problems with an application, you can go to the screen on this slide to delete or modify applications. Facebook groups can easily be created from within your personal Facebook account. You can see that the Create a Group tab appears on the left-hand side toolbar, and above this tab, you can see other Facebook groups that I belong to. I like Facebook groups because I can interact with other group members when I want on my own time. I can see that there's one new message from the CPDD group and 8 new messages in the Transformation of Healthcare group. I have control over how I'm notified of new group messages and whether I want to actually get an email alerting me or not. Once you click on the Create Group button, you can name the group and select members. So when setting up a Facebook group, you're doing this when you have a defined set of people that you want to be interacting with. You can set the privacy settings regarding whether you want members only to see the posts and whether non-group members can view a list of group participants. I think, Liz, we're going to go to quiz 1 now.
Sure.
Okay.
Here's the first polling question.
This is our first polling question. Google is the most popular search engine in the world. Which is second?
I'm going to go ahead and show results, Erin.
Okay. All right, I'm surprised. A lot of people got this question wrong. It's actually YouTube is the correct answer. Okay, we'll go ahead and move back to the slides.
There you go, Erin.
Okay, thank you. Now that we've covered the basics of setting up Facebook pages and groups, let's move on to some more advanced options that you're going to want to be aware of. And if you've logged into Facebook today and you have a page, you'd be notified that they are going to be changing the design of Facebook pages as of March 30th. And most likely it's just integrating the timeline feature that's been available in personal Facebook pages for personal Facebook accounts for probably a couple of weeks now. Once you have 25 Facebook page fans, you can select a username, which is used to create a web address for your Facebook page. This is great because sometimes it can be challenging to find a Facebook page when you don't know the exact name that they use to set that account up. Once you have a simple URL, you can add it to your email signature as a strategy to build your Facebook fans. There are multiple ways to manage privacy within Facebook. The most basic approach is to select privacy settings from the top right-hand downward-facing arrow. You can set different levels of security for your posts, your pictures, and whether people can tag you in photos. You can control who has the ability to post to your wall. I personally have chosen the custom option, and you're going to want to explore this tab in depth. And additionally, there are occasionally changes to privacy settings in Facebook, so it's a good idea to check this tab periodically to ensure that it's accurately reflecting your privacy preferences. When Facebook changes the privacy settings, you'll usually see a flurry of posts from your friends that alert you to the changes, and they usually always post detailed instructions on how best to protect your own privacy. Once you set up your global privacy settings, you can control who can see your individual posts. This is an important feature now that you've had the option to either friend someone or you can subscribe to someone. You can also categorize your friends into groups, allowing you to do targeted messaging. This feature works well for personal Facebook accounts, but not as well for pages. And remember, while you can control privacy settings of posts, you cannot control who sees a post when someone else shares it. So don't get a false sense of security there. Within the Manage Permissions tab for a Facebook page, you can indicate whether people can post to your wall or add videos or photos. For clinical settings, you may not want to allow people to post on your wall. However, this would limit the ability of your Facebook page to be interactive. This is an important consideration because you cannot email fans or send a direct message to an individual or a page from a Facebook page account. The only mechanism to push information from a Facebook page is to post it to your wall. A beta version of email for Facebook pages is being tested, and I hope it'll be available later this year. This is going to be great for recruitment and follow-up for research studies. If you choose to allow people to post to your wall, you may want to also post a comment policy and occasionally remind users to follow the policy and that a violation of your policy may prohibit future interactions on your Facebook page. You can hide posts or report them as abuse or fraud as you need to. For more information on developing a social media policy, please see our slides and resource guide from the first social media webinar, both of which are available in the NIDA CTN Dissemination Library. Depending on your target audience, you may want to set up a profanity block list. The OVN Facebook page has been up for 18 months, and we get very few comments or posts, so we haven't had to block any language or delete any negative posts, so this really hasn't been a problem for us, but just in case, I wanted you to be aware of this option. The OVN is using social media to, 1, disseminate evidence-based treatment for substance use disorders, and 2, to build relationships and social community. So while, of course, I fret over how many likes our pages has, I also want to like other pages. And in fact, we're pretty gregarious online. We have a liberal attitude towards liking. We do it frequently and without regret. But we also want to feature our Facebook pages of our closest colleagues. So from the Edit Page button, you click on the Featured tab and select from among the pages that you like a smaller subset of pages that will appear on your Facebook homepage. So if you've done any online shopping, it's like saying, if you like me, you'll probably like the NIDA CTN Dissemination Library, SAMHSA, or the ATTC's Facebook page. Liz, I think we're ready for quiz 2.
Okay.
Okay, quiz number 2. Facebook limits the number of friends a user can have to 5,000, but how many friends do users have on average?
I'll go ahead and show results.
Okay, you guys got the answer correct. It's on average. It's about 130 friends. Move back to the slide, presentation. Okay. All right. So now we're going to cover how to set up a Twitter account. This is so much easier than Facebook. And it's mostly a lot easier because it doesn't have its limited functionality in comparison to Facebook. So you can easily set up a Twitter account from their home page. Username should identify you, be easy to remember, simple, and you're only limited to 19 characters. You can use alphanumeric plus underscores, including both upper and lowercase letters. If you're having trouble selecting a username, Twitter will suggest alternative names. And of course, you need to choose a unique name that is not already being used. From the Profile tab, you can select a profile picture. And using a real name and a photograph conveys that you're a real person, much as we said for the Facebook pages as well. Your profile on Twitter is extremely limited, unlike Facebook, so you really, really want to include a web link to your company's homepage. Again, this is particularly important because this may be the only way to verify your identity. I frequently link to Twitter profile web pages because I want to ensure that I'm following who I think I'm following. You have the option to not add a location to your tweets, which is something that you might want to do if you don't want people tracking your movements. Which is the real Homer Simpson account? Well, the star indicates that the official Twitter account that has been verified by Twitter. However, this verification process is no longer available to the public, and Twitter suggests that you include a URL that verifies your identity. So it's really, we're on our own with that verification process. So in fact, my Twitter profile picture is the exact same picture that appears on the University of Cincinnati faculty page. Although I'm not really important enough yet for anyone to try to be me, maybe someday my identity will be as sought after as Homer Simpson, or maybe that's just wishful thinking. I think maybe I should just have a donut. Okay, here is Dr. Volkow on Facebook. We should have made this a polling question. Again, as we saw with Homer Simpson on Twitter, buyer beware. Dr. Volkow is not on Facebook, or at least her profile is not publicly searchable. As you can see on the slide, this seems to be automatically posted from Wikipedia. So if your Facebook intentions are truly only professional, you can max out the privacy settings on your personal Facebook page and set your profile as not searchable. In this case, you really only have a personal Facebook account so that you can log in to manage a page. I think we're ready for quiz 3. Okay, who is the most followed person on Twitter? Britney Spears, Ashton Kutcher, Ellen DeGeneres, the Dissemination Library, Lady Gaga, or our own Gloria?
I'll go ahead and share results.
I want to thank those 3 people for their vote of confidence.
So actually the answer is Britney Spears. I actually also got this wrong. I thought it was Ashton Kutcher as well. We know that him and Demi Moore Twitter a lot, not that I follow them. But all right, let's go ahead and move back to our slide presentation. Okay. You can set up notifications to alert you when someone follows you or sends you a direct message. This is a great option for users who don't log into Twitter every day. I use a third-party application to push my tweets to Twitter, so I don't have to log in but about once a week. You can organize your Twitter accounts you follow into lists, which is essentially necessary when you follow hundreds of Twitter accounts. I'll show you more about this in another slide. When you add apps to you can add apps to Twitter, although I infrequently use Twitter apps, whereas I use apps in Facebook a lot. If you have any Facebook or Twitter apps that you recommend, please email me. I would love to learn about them. You can set up the design of your background. There are apps that help provide enhanced capabilities in designing your background. They tend to be fairly simple and you probably don't even need to use them. You can post a picture of your company or logo as the background. So in this case, you can see on my Twitter account, I use a profile picture of myself so people know that I'm a real person, but in fact, you can see the OVN logo is being used in the background of that account. So 2004 to use the phrase 411, but I think you get the picture. The last time I dialed 411 was when I had a rotary phone. Moving right along, you can use Twitter to search for information or to just see what people are tweeting about. So last week I searched the term addiction in Twitter. During the few seconds it took to take the screenshot for this slide, there were already 20 new tweets, so it's a popular topic. If you want words within your tweets to be searchable, use the hashtag and start your own search. This is just a brief introduction, and our social media resource guide includes references to learn more about Twitter and Facebook, but here are a few Twitter terms to get you started. The @ symbol is used to post, to generate a link to a user's profile within your post, so you would do @ and then you would immediately do, say, for example, AOD treatment works, that's my Twitter username, and it will link directly to my Twitter page. You can also use the @ symbol in Facebook if you would like to, if I were going to post about the night of CTN webinars, I can use that @ symbol as well to create a direct link to that page. The hashtag is used to generate a keyword or a search term, as we already mentioned, and it would be great if we could start to use the hashtag night of CTN in our tweets so that we can easily search the term and track our combined Twitter activities. You can use hashtag FF to recommend people to follow on Twitter on Fridays. And you don't always have to be thinking of a great post. You can simply retweet other users' posts, and that's RT, retweet. And quiz number 4. Syracuse University offered 4,100 graduates this spring a complimentary subscription to what? Internal social networking site, online reputation management system, newspaper, video chat service.
Okay, results are shown.
Okay, what did people guess here? They actually offered an online reputation management system. So I had actually thought maybe a newspaper. I was going to kick it back old school, but no, they are helping people manage their online reputations, which I thought was really interesting and probably very useful. So go ahead and move back to the slides. Okay, there we go. We're going to cover some tricks and helpful hints that you should be aware of. First, I want to talk about Pinterest real quick. We did not cover this in the first webinar. It's an online pin board. In our pre-webinar survey last month, we found that a small handful of our webinar participants were using Pinterest, and later that night, I heard a local news station feature a story where a woman was saying that she's so over Facebook and Pinterest is the next big thing. So I had to find out about it, as any early adopter would. But it turns out I joined late in the game. It has been around for 2 years already, but it really has been seeing increasing popularity in the last few months, particularly among women. It's the modern-day version of scrapbooking. Within 3 months, you probably won't be able to go into Michael's and buy the raw materials to make an actual scrapbook anymore. Pinterest is best for visual content, and it allows you to download a Pin It tab to your browser so that while you're surfing around the web, you can simply click Pin It to place a picture on any of your virtual bulletin boards. So last week I pinned a picture of an Arrow Shot, which is a device to inhale caffeine, on my drug abuse bulletin board. You can also see on this slide that I've started to pin infographics on drug use on this board as well. Pinterest interfaces with Facebook. However, you cannot pin images from Facebook, and some web pages prohibit pinning. As an interesting aside, you can post copyrighted material until you're actually asked to take it down. Tweetdeck. Our first tip pertains to saving time by using applications that allow you to simultaneously read and cross-post to multiple social media accounts. This is how you take the crazy making out of trying to manage multiple social media accounts. Tweetdeck and Hootsuite are two free applications that you can use. I prefer Tweetdeck. Gloria prefers Hootsuite. But you can really try them both out. The small circled images on the slide represent my various social media accounts, and I can select as many or as few accounts to which I'd like to post. When I include a web link, Tweetdeck will automatically shorten the link. I like Tweetdeck because it allows me to easily read news feeds across multiple social media accounts. So you can see there that I have my Twitter account, AOD Treatment Works, my LinkedIn account, my full Facebook feed, and one of my short lists on Twitter. Hootsuite works fairly similar to Tweetdeck. However, it has some advanced features that are available for a fee, like posting to Google+ or managing more than 2 Facebook page accounts. Hootsuite has some cool features like the ability to schedule a post for a future date and time. You can also view your Twitter lists on one screen. So on the slide, you can see the Twitter posts from my list called Professional Associations, Journals, and Addiction Treatment Facilities. When using either Tweetdeck or Hootsuite to cross-post, remember that your Twitter posts are limited to 140 characters. Some experts suggest that you should actually limit it to 120 characters or less so that others can comment and retweet without truncating your original post. Facebook Insights can be used to learn about your audience, your fans. While everyone thinks that Facebook is most popular among adolescents, you can see on the slide that the OVN page doesn't even have any followers under the age of 25 years old, and 69% are female. You can see the geographic location of your fans. As you can see, we've got the greatest number of fans where we're located in Cincinnati, but when you select the Reach tab, it's right below the Likes tab that's highlighted on the screen, and it's not shown here. I can see that in the past week that 15 people from Mexico, 1 person from Japan, and 1 person from France has viewed the content on our page in the past week. When you click on the See Likes button, the default is to list people, and you'll need to select the downward arrow in order to see which pages like your page. And then you can like their page. Reciprocity is really important in social media. Follow people who follow you on Twitter, like pages that like your page on Facebook, provided, of course, that these are legitimate accounts and not spam. If you're really popular on Facebook, like my cousin who has over 1,000 friends, or maybe you don't want to see some of your friends' annoying posts that describe the most boring aspects of their day, you can filter their updates. Setting up filters helps you find important information quickly. And if you find someone's post or online behavior really offensive, remember you can unfriend people. The Huffington Post monitors comments to ensure that people feel safe and that people are not virtually attacking each other online and ruining this virtual forum. So we should take appropriate steps to ensure that our virtual forums are welcoming and not alienating members with vulgar, inflammatory, or derogatory language. As I mentioned earlier, you can create lists within Twitter. So I've created a list for the NIDA CTN members so that I can see what they're talking about. Sometimes I might want to view only the professional association lists so that I can get information about upcoming conferences or abstract deadlines. One of the lists that I use most frequently is actually my news list for like ABC News or Health News, and that includes some ABC News has a sort of health-only section, and of course there's several accounts set up that post about interesting news about drug abuse. This is a great source of Twitter content. So, for example, Time Healthland has an addiction reporter that is in recovery, and she routinely writes articles about hot topics in addiction treatment, and I frequently retweet them. Another feature that you might want to be aware of is that you can actually lock your lists so that they are not publicly viewable. So no one can have access to my list. Well, you're seeing them now, but you can't see the individual numbers there. I think we're ready for quiz 5. Match the term with the phrase it most relates to, microblog. Is microblog a marriage of applications, less than 140, common followers, a URL shortener, connections, or common knowledge? Okay, you can show those results, I think. Yes, most of you are right. It is less than 140 characters. So microblog is usually referring to short text updates. I'll go back to the slides. Okay. I'm going to transition here briefly to share with you some data from 2011 for the OVN Facebook and Twitter accounts. We've been using Twitter and Facebook for over a year now, and I'm working on analyzing a subset of data from this first year of using social media during basically all the data from 2011. AOD Treatment Works, my Twitter account, at the end of 2011 had approximately 280 followers, and 192, or 69%, were categorized as our target audience. I define my target audience to include any individuals or organizations interested in alcohol or drug information. This ranges from addiction treatment centers to funding agencies to individuals whose profiles specifically mention an interest in drugs, addiction, or recovery. On average, these organizations had approximately the same number of followers and the same number of Twitter accounts that they were following. So the average is 3,100. It's represented by the blue dotted horizontal line on the screen. This really supports the importance of reciprocity that I was talking about earlier. So again, we see this equivalence between followers and following. The average number of tweets was 1,400 and is represented by the purple dotted line. Among the 42 AOD treatment facilities that follow me, the average number of tweets was 581, and they had about 2,100 followers or were following 2,100 accounts. Besides funding organizations, clinicians have a lot of followers. If they retweet or share your tweets, it will really expand your reach significantly. So on this slide, you can see that I'm showing you my Twitter followers who have the greatest number of followers. Did you get that? So it's my top followers, target audience. Optimizing the reach of your tweets can incrementally increase when even one tweet is shared by someone with thousands of followers. The SAMHSA Twitter account has over 13,000 followers, which is probably not surprising, right? So it turns out that the NIDA News Twitter account actually only has half of the followers that SAMHSA has. And on this list, you can actually see there's 2 treatment facilities. So if you look down towards the bottom of the list is the ARC. That's a treatment facility. The ARC's first tweet was on January 2010, so they've had 2 years to build up their following. The ARC has a lot of followers. They've got about over 24,000, but they actually don't tweet that often. That seems to be, what do they tweet? They've only had 184 tweets over the past 2 years. It's like a man. And it averages out to actually only 1.8 tweets per week. And as an aside, the ARC has a very simple and elegant Twitter page as well as home page, so you might want to check that out. We have a lot more followers on Twitter than we do on Facebook. As of last week, we had 65 likes or fans on Facebook and 308 followers on Twitter. So that's a big difference. And we might conclude that Twitter is a better mechanism if our goal is to expand the reach of our dissemination efforts. Despite our low numbers of fans, we are still getting a lot of traffic on our Facebook page. Our mean monthly reach is 129 individuals, even though we only have 58 likes. So again, people are visiting the page, they're not liking the page. So during 2011, our Facebook traffic had this huge spike that you can see on the screen during a few weeks in late September, early October, and I was trying to figure out the explanation. Of course, my first thought was that I finally figured out the best, post ever, or that I was posting on a particularly hot topic. And when that didn't pan out, I finally figured out that this was a time period that corresponded to a peak in our in-person dissemination activities. During this time, we presented in 3 states within 8 days, and the peak post was on the day that I shared the NIDA CTN library link to these presentations. So it's really nice to see correspondence between our in-person and virtual dissemination activities. One of the main points from our first webinar was that social media is about relationships. It's not just virtual, but a mechanism to maintain relationships with people outside of your immediate geographic area, and so I think this really speaks to the connection between those two. And although I still don't really know why people are hesitant to like our Facebook page, and I'm not sure if they think it's equivalent. I mean, I might hypothesize that it's because they think that it's like being friends and then I'll have access to their information. I think we're ready for quiz number 6. I think it's our last quiz. Match the term with the phrase it most relates to. Bitly. Marriage of applications, less than 140, common followers, URL shorteners, connections, or common knowledge. Okay, do you want to show the poll? Looks like most of you have gotten this correct. The answer is URL shorteners. So just in case you were wondering what the other terms match to, marriage of applications refers to a mashup, and common followers refers to, what's common followers, sorry. Where are we? Common knowledge is referred to as a wiki, like Wikipedia. Connections is referring to LinkedIn. So on LinkedIn, you have connections. Twitter, you have followers. On Facebook, you have friends or fans. And let's see, did we cover most of that? Yeah, let's just go ahead and move on back to the slides. Okay. So during our first webinar, I showed you a map of my LinkedIn profile, but I didn't tell you how to do it yourself. So I wanted to include this slide. It's really super easy. You go to the URL on the slide, and as long as your LinkedIn profile is 75% complete and you've got at least 50 connections, you'll be able to visualize your own social network. As a quick aside, yesterday I was working on a presentation that I'm going to be doing this April in Iowa, and I want to integrate local data to make the presentations more meaningful. So online I found this website, the Iowa Substance Abuse Information Center. So I called and I spoke to their director. While we were talking on the phone, we were only on the phone for about 15 or 20 minutes, she found my LinkedIn profile so that she could download information about the OVN, since Iowa is one of the states that we work with. I used the OVN Facebook page to like the Iowa Substance Abuse Information Center page, and voila, we were virtually connected. So with relatively little effort, I've potentially made this very important connection to expand the reach of the NIDA CTN findings to treatment providers in Iowa. As you begin to use social media, it's hard to grasp all of the different options to get involved and to make a decision regarding where to start or where to concentrate your efforts. In the first webinar, we talked a lot about how your social media strategy would help drive your goals of using social media and how that influenced your decision to use different social media platforms. Today, we're going to expand on this topic to consider how the time commitment of participating in social media may influence your social media choices. In sum, the more interactive you want to be, the greater the time commitment required. If you don't want to interact and you just want to push information out, then perhaps you simply want to make information available on your website. All social relationships, whether they're in-person or virtual, require a time commitment. You need to make a commitment to engage and foster those relationships in order to strengthen those ties or grow your social network. Another thing that isn't included in this graph, but is important to think about, is do you want to preach to the choir, disseminate information to a defined group of like-minded people, or are you trying to reach out beyond your network? If you want to interact with people you know, then Facebook is a great option, particularly when we're talking about personal Facebook accounts, because you most likely know all of those people. It's a little less true for Facebook pages. If you really want to expand your reach then, but maybe Twitter is going to be a better option for you. You tend to know a lot fewer people that you might be connected with on Twitter. The text in this graphic may be difficult to read, particularly for those of you with smaller computer monitors. This is a tongue-in-cheek term. The first box on the left-hand side says, Do you want anyone to actually see it? If you answer no, then post it to Google+. So yeah, Google+ isn't that popular yet, but who knows in a couple of months. The next box suggests that if you're in a bar, you should post on Foursquare, which we haven't covered at all because you do it in a bar, right? But you can explore on your own. Another box says, would it be awkward to explain the post to your boss or your parents? If so, you shouldn't post it. That is really good advice. If it's work-related and the content is boring, then you should post it on LinkedIn. And finally, if you want to be liked, then you need to post it on Facebook. And who doesn't like being liked? I do. On a more serious note, though, what I'm sharing this graphic is actually because it actually got over 14,000 shares, and it demonstrates that clever graphics can be a good strategy to grow your fans. This is my final slide. So I just want to think about how do people find us. And last week I saw Arianna Huffington speak. She's the founder of the Huffington Post. You see that I tend to talk about her a lot. The Huffington Post is one of the largest online news outlets, and Arianna Huffington was named by Time Magazine as one of the most influential people. During the talk last week, she said that nearly 1/3 of traffic on the Huffington Post is from social media. So people post a link to the Huffington Post article on their Facebook or Twitter accounts, and then users click on the link, bringing them back to the Huffington Post website. You can use social media to disseminate evidence-based treatment for substance use disorders, and wouldn't it be great if we could exponentially increase traffic to the NIDA CTN library website, making our results available to a broader audience? We can use social media to drive traffic to our treatment and treatment research websites as well. If patients are not aware of your facility, they cannot seek treatment there. If people are not aware of your research study, how can they volunteer or participate? Meeting people where they are at increasingly means that we're going online and having a social media presence. And with that, I'm going to turn the presentation over to Gloria.
Thank you, Erin. And just as an example of how quickly things change on social media, Erin was talking about the new Facebook pages, and there's been a change that they are going to look more like the timeline that got rolled out this morning. And Erin also mentioned the capability of messaging from pages, and so half of that capability seems to be active on Facebook pages today. So people can message your page, but you can't message yet from your page. So it is really quite amazing how quickly things change on social media, and it is important to keep up with what's current, because even though maybe nobody will see what you post on Google Plus today, maybe in 6 months they will. So maybe we'll have to do an update in 6 months or so. But in the meantime, I'm going to be talking about how we can use social media in our research and with our practice as well. And just as a warning, my slides are not quite as fun as Erin's, but just full disclosure. All right, let's see if I can drive this baby.
I can drive for you if you want, Gloria.
Thank you.
Okay.
All right, so who can we reach with by using social media? Go ahead and click again. Oh, go back. There we go. We can reach pretty much everyone, because as we saw in our first presentation, there are billions of people using Facebook and social media now. And so if you, depending upon who you want to reach for one of your studies, you can reach them in a very specific way. So we're going to start by talking about Facebook advertising, which is probably one of the most targeted and pinpointed ways that you can reach potential participants when you have a Facebook presence. So what's amazing about Facebook advertising, if you're on Facebook, you see them all the time, the Facebook ads are incredibly specific and pinpointed. So if on your personal Facebook page you gravitate toward sites and activities around crafting, you will notice, it's like magic, that the ads that come up on the right-hand side of your page will have things to do with crafting. I find that on my Facebook page, I get a lot of advertisements for educational programs. They want me to go to USC and get another degree because it's clear from my profile that I value education. And so the ads that I see a lot of times have things to do with education. There's also shopping and food, but that's a whole other story. So you can really pinpoint your advertising to exactly the person who you want to reach, and we're going to see a little bit more about that in a second. And the way you can set up these ads, it can be very cost-effective because you're going to pay for each person who clicks on the ad or for how many people who see it. And I would recommend, from what I've heard and seen, to look at the pay-per-click as a better option because you want to get people who are interested. And if somebody clicks on your link, that means they're probably interested, and that's worth paying for. The algorithm for payment is somewhat complex on Facebook, but you can set a budget and see how that goes. So we'll talk about that in a second too. So the next slide. So there is a really great tutorial about creating Facebook ads through the Facebook marketing page, and we've included a link on this slide so that you can visit that as well. But we've taken some of the information from that tutorial to show here. But what you want to do, like I said, you want to make sure that you're targeting your advertisements correctly. And so you can target by gender, by age, by where a person is. So if we're doing a multi-site study like we do in the CTN, you can delineate zip codes all over the country where you want your ad to be seen. But if you're letting the ad locally, you can delineate those zip codes as well. And then you can pinpoint people's interests. Like I said, I see a lot of ads for education. So the MSW from USC, they are finding people who maybe are interested in psychology, who are interested in mental health, who are interested in education, who already have a higher education profile. So you want to be as specific with interest as possible. So in one of our studies, you might put interests related to recovery, or if you're doing a study on anxiety, on stress relief or meditation, and really focus those ads on the interests of your target. You're really looking at the inclusion criteria for your study and building it into your Facebook advertising. So it can be very handy. This is just a little graphic on how the payment for Facebook ads work. And in the example in the tutorial, it is a pizza place, and they have different campaigns focused on different parts of their target market. So either college students, families, or people who are looking for bargains. And you can see in the budget column that they have a daily budget for each campaign. So if you want a daily budget for men click-throughs and a daily budget for women click-throughs, you can set up your ad like that. And then it also gives you data on who's clicking through and how much it's costing you and how much you spent. And like anything in social media, and what Erin has talked about and what you've heard, and if you've been on the last two calls, it's just important to monitor what you do. So if you put up a Facebook ad, it's important to look at these insights because Facebook does give you a lot of information about where you're getting your clicks and how effective your advertising campaigns are. So there's a lot of great data to be had. This is a page also from that tutorial that is is very helpful in terms of if you have an ad and how you're going to manage those ads and think about creating the text of the ad, the image that goes with the ad, where the person is going to click, what the destination of the URL is, where they'll land, again, who you're going to target, and going back and taking a look at how your ad is working and making some changes to keep it fresh. So here's an example of a Facebook advertisement, and this is from a study of health behaviors for young women, and this is a published article, and we've included the link so you can take a look at how this study recruited young women between the ages of 16 and 25 in a specific region of Australia. And these are the two ads they chose, and you can see they use a little bit different text, and it's good to maybe create two ads, and you can see which one works best. Do a little bit of market research while you're at it. The pictures they use are of their target, of who they're looking for. And you can see they ask one of them asks a question. That's a really good way to get people's attention and engage people in thinking about if that might be for them. So this is one example of a Facebook advertisement that was used for a study. This is another one that actually, I think, popped up on someone else's timeline, and this is kind of the series of what happens when you click on an ad. So if you get one of these, okay, so this is an ultrasound tech. So what happens when you click on that ad? You click on it, and then you go to a landing page that asks for information. So if you're setting up a study, you can have an ad and then create a page that collects a person's information if they're interested in learning more. You can even put a short screening questionnaire in a landing page like this to collect some information. Because what's important to know, and that if you run into this question with IRBs, and we're going to talk a little bit more, we'll talk more extensively about IRBs in a minute. But when somebody clicks on a Facebook ad, personal information is not collected by Facebook. There is no personal information that is captured. What happens is you get kicked out of Facebook into an outside domain like the one here that's on the page, or a landing page or a questionnaire page that you would set up for people to visit. So that's something that's good to know. The only information is there of a very general type, like gender, of the interest that you might add into your advertisement, but no personal information. The person is not pinpointed who clicks on your ad. They have to fill out the form on the separate URL in order for you to collect their information. So it's a great opportunity to share more information about your study and possibly collect information from potential participants. And here is a post that was on the NIDA Facebook page. And if you are not a follower of the NIDA Facebook page, you probably should be, because they do put out a lot of great information on a regular basis. And here, this was a way to drive people to their main site to find out about, in general, research studies that are offered through NIDA. So you can see the post on research studies help us to understand how drug abuse affects the body and brain. We're looking for users of cocaine, heroin, marijuana, ecstasy, et cetera. And then it puts the shortened URL, bit.ly, everybody knows what that is now, to drive you back to NIDA's page. And then it gives, again, very general information about the studies that are available that people can then click through for more information to see if they're eligible for a specific project. So this is how NIDA is using their Facebook page, not only to engage people, because as I said, they do post a lot of very good information and recent reports and recent studies that have come out, but also let people know about other research that's going on and try to get them to visit the page and find out more about them. So that's how you can use Facebook as a way to potentially recruit participants. Now also, now that you all have Twitter accounts, you could potentially tweet your way to more participants. And you can do that in the same way as you use a Facebook post by letting people know you're running a research study and posting a link back to a landing page that was like the one we saw before for the ultrasound technicians, where you could collect people's information or just give them some information about your study. You can also connect with other providers and agencies in your area, like Erin has shown us how she is very strategically connected with alcohol and drug treatment providers, with different professional organizations, and all of those places, if you are following them and they're following you, when you tweet about things that you have going on, they will see that information. So you can connect with those providers, you can tweet about your study, you can include even some contact information, all under 140 characters. And as Erin also described, you can use these hashtags, which are searchable terms that people might be looking for. Twitter is used as a search engine quite a bit. When people find out there's something going on in the world, they'll go to Twitter and hashtag search for it. So it's a great way to find out what's going on and to spread the word about research that you might be doing. And then there's other ways to use online sources to engage people potentially in research. You can post on discussion boards on sites that are related to the topic you're looking for. So there are all kinds of discussion boards and chat rooms related to addiction, and you can certainly, depending upon the content, and we'll get to that in a minute, post in those discussion rooms depending upon also their rules for that. There's always Craigslist. There's links that you can put on websites and your own website. And some people have used a Facebook group page as a way to do some like snowball sampling. So they might post on a page where people are already connected and say, hey, we've got this research study, tell your friends. But there are issues around the random nature, obviously, of the participants that you're going to collect. And you know, is this a way to randomly select participants? I mean, are there biases related to collecting or recruiting participants using social media? Sure. They have to be on the site. They have to see the ad. But the bottom line is the majority of people are on social media. And so while there may be some biases, you're also going to be getting a pretty large subsample of the general population who you can potentially reach through these methods. And then there are ways to stay engaged with people using social media. If you have your study page set up, like some of the pages that Erin was talking about, you can post the status and updates on what you're doing to those pages to keep people involved and informed. You can also use Facebook messaging or email to send scheduled messages to participants. And we're going to talk a little bit about texting, because texting is not social media, but it is new media, and more people are using it to keep engaged with study participants, and you can use it to remind people of appointments as long as you have their consent to text them beforehand. So there are some studies that are using texting to not only remind people of their appointments, but remind people if it's a medication trial to take their meds. And it serves as a reminder for them to do that. So there's lots of ways to use these different technologies. Okay, now we're going to move into some of the IRB and regulatory and logistic issues in using social media. So one of the main concerns about using social media in research is that of confidentiality, and that you can use something like Facebook as a way to eavesdrop on potential participants and their conversations and determine whether or not maybe they are suitable, and if you want to try to find them and court them to be in your study. And so there are issues with that, and certainly we want to be very aware of and mindful of our human subjects protections and typical confidentiality protections, HIPAA laws, et cetera, that we need to abide by no matter what kind of communication we're having with people. We want to make sure that we're abiding by all of those good guidelines that we all know. But the fact is that even though some of this is uncharted territory, that social media really is here to stay. But the problem is we really don't have any guidelines. The FDA held a conference about social media, and it was more focused toward how drug companies could advertise their products on social media sites. But they did that, they hosted that conference, I believe, in November of 2010 with the intention of coming up with some guidance by March 2011. Well, tomorrow is March 2012, and we still don't have any guidance from the FDA on that one aspect of using social media in communicating research results and about medicines. And we also don't have any guidance from OHRP about this. So what IRBs are doing, and what we should all do, is really look to our standards that we use on a regular basis to protect human subjects. And those that most of us are familiar with are the CFR and all of the guidance that comes for IRBs and for clinical investigators doing human subjects research. So basically any guidance that we have related to print ads, we would want to apply to the ads that we create for social media. And there are a couple of other things that we need to consider too, but why don't we just review some of those right now. So like any other advertisement, we don't want our ads to be unduly coercive. They can't imply favorable outcomes or other benefits that are not potentially there. They can't communicate any safety or effectiveness information, and they really need to avoid the therapeutic misconception. And the therapeutic misconception is when we are testing an intervention, we want to make sure that we're not passing it off as a proven treatment. That research interventions are not intended, yes, we want them to be therapeutic, but we need to make clear that there is a distinction between therapy and testing an intervention, especially when we have random assignment. People might get some kind of placebo or be in a control group, and we can't promise or can't imply that our interventions are going to provide effective treatment. So these are all standards that we would use in any other advertisement, but also would be true for anything in social media. So what would need to be reviewed by an IRB? Well, any direct advertisement or explicit information about a trial. And this could be disseminated through a Facebook page, through tweets, through text messages, blogs, those landing pages where you collect information. Anything like that would most likely need to be reviewed by an IRB. And certainly any sites that collect any protected health information. So when applying to an IRB and saying that you're going to be using social media, you want to address how that information is gathered. what happens to it after it's collected, any privacy issues that you're addressing along the way, which may be of even greater concern to IRBs when we're using these kinds of methods.
Gloria, we do have a question from the audience.
Okay.
Lisa is stating, I do not often open advertisements on Facebook because I fear that they may be spam or have a virus attached to it. How do you encourage users like me to participate? Furthermore, do you have any recommendations to make advertisements for research study recruitment seem safe to click on? You might have done that a little bit, but if you want to expand a little.
Well, I think there are some people who are going to click and there are some people who are not. There's part of the inherent bias of using these methods to collect information. And there are some people who will click on anything, and some people who will take a look at something to see if it might be more, that it just kind of has to look more legitimate. So by using professional language, by noting, I think that example that was used to recruit young women in a health behavior study, that was a good looking ad. And if I was a young woman who wanted to participate in research, that might be something I clicked on because it did look legitimate. Use good photographs, maybe avoid clip art. Might be one thing for the visuals. But I think there are some people who will click and some people who won't, and that's just the way it's going to work. Erin, would you have anything to add?
No, thanks, Gloria.
Yeah. But that's a great question.
And, I encourage the audience, if you do have a question, press *1, and we'll go ahead and take your question in the order in which it was received. You can go ahead, Gloria.
Okay. All right. Now, you can also use social media for ongoing communication with the participants in your research study. So once people are in the trial, you may need to have those communications reviewed by an IRB, again, mostly for privacy and confidentiality concerns. And those could be those same reminders through email, Facebook, or text. And these could be about appointments or reminders about adherence. Now, typically in a research study, your IRB may not need to approve those kinds of messages, but since you're using social media, possibly the IRB would want to review them because now they're being shared in a different way that has different kinds of privacy concerns and different potential for possibly violating confidentiality than maybe in a phone message. So those are the kinds of things you may need to address and that may need to be brought to an IRB. So what kinds of things don't require review that are shared using social media? And here I'm also including blogs, anything that shows up online, or any kind of communications between health professionals or other researchers. So the communications that we have among ourselves, those about a study, obviously those don't require review. News stories about a study. So a story about a research project that's going on, not a story that then includes a recruitment piece. Okay, so it's just informational, it wouldn't require review. If the publicity about a study is intended for other audiences, not potential research participants, then that wouldn't need review. Obviously, anything a participant shares directly. So if a participant who's in your study writes on his own Facebook page about this great study that he's in and you should contact these great people that I've met at my treatment program, obviously that's outside of your control and not reviewable. And then websites that contain general information on the study, like that NIDA website, the NIDA ad that I showed you before. It's very general, and so would not require an IRB review, and then information at clinicaltrials.gov as well.
Gloria, why don't you take
Yes.
a sip of something to drink, and I'll read you a question.
Great.
Okay, so Amy's asking, if a study subject or potential subject contacts through Twitter, for example, will you need an IRB to approve your response? Should you respond via direct message versus a tweet?
Nice question.
No.
Yeah, I would encourage you to respond with a direct message to a potential participant. Absolutely. Just as if somebody messaged you or left some kind of post on your Facebook page about a study, you would not respond to them right there on the page. You would send them a direct message or a private message, and I would say you'd want to do the same thing with Twitter. Okay, next slide, please. So some best practices in dealing with your IRB. This is right now still new to IRBs. I know the Columbia IRB is working on some guidance around social media, and that the medical center recently put out guidelines for employees on using social media. Things like maintain confidentiality, follow the HIPAA requirements, physicians should not friend their patients, those kinds of things. But IRBs are starting to come up with this kind of guidance. And in the meantime, we need to be communicating with them, letting them know what we're doing, and seeing if they need additional information from us. If we have a plan to use social media, we should include it in the protocol, and also include the procedures in the consent form and any potential risks in the consent. So things like there may be costs associated with text messaging. People know that, but you would want to be explicit. And there may be increased risks to privacy by using social media. Again, people know this, but in our consent forms, we want to be explicit about that. I'm going to talk in a little while about a study that we did with CTN 44, how we've been using social media with that study, and one of our sites had a pretty explicit description of how their page was set up and how the privacy settings were set up as an addendum to their consent form for participants to see and sign. So as much disclosure as you can make, and working with the IRB and making sure that you're meeting those requirements. That's really our best practices at this point. So when you're creating a study page, and I think Erin has dealt with some of this already, you really want to use the strictest Facebook privacy settings when it's for a study. Now for your node, for dissemination purposes, you want people to be able to interact with your page. But if it's for a study in particular, you really want to have the strictest privacy settings. Make sure everything is set to friends only. The friends should not be visible on the page so that people's confidentiality is protected. And also you can put just pretty basic set of contact information to not disclose too much about what the study is about, or not really, very little about what the study is about. Also, Facebook users would only be able to send personal messages to the study page, and now that is possible on the new Facebook page format. So another way to use Facebook is to try to find participants, and that could be a very good use for it. But with like at the beginning with the guy with the glass, we also want to be very aware of people's privacy. So when you're trying to find somebody on Facebook, you can cross-reference their profile to really confirm their identity. So if you're looking for Thomas Jones, there probably will be quite a few. So if you're looking for Thomas Jones in Cincinnati, that'll narrow it down a little bit. And then if you're able to take a look, and you could see maybe if Thomas Jones' friends match those friends on his locator form, then you know you're onto something. But do not just send emails to people who may or may not be the person you're looking for. Also, obviously, if there's pictures up there, you can also control some people's photos depending upon the privacy settings to see if it's the person that you're looking for. So just want to be careful, again, not to violate anybody's confidentiality through Facebook or through messaging. And again, the content of your messaging may need to be approved by the IRB. I saw a study where they used Facebook to try to engage people who they had lost to follow-up, and their recommendation was to discontinue contact attempts after 3 times. We tend to continue trying to contact people until they tell us not to, but that's something that you might consider. And then also in your locator forms, as you're talking to people about how they want to be contacted, make sure that you note that down. And if somebody says, I check Facebook way more than email, can you send me a Facebook message? Then note that on the locator form and go with that. That's just good follow-up procedures anyway. All right, so I wanted to present a little bit of the data that we've been collecting and the procedures we've used in CTN 44 for social media. And CTN 44 is a web-based study looking at the effectiveness of the therapeutic education system, TES, and which is the web-based version of community reinforcement approach plus motivational incentives in outpatient treatment. And we had 10 studies 10 sites that participated in our study in 9 different nodes. We are about 4 months away from our last follow-up subject. We had 510 participants overall in the study. And in our original contact and locator information, we asked for email, cell phone, and texting, but we didn't ask for social media. And so it was later on in the study, after we had already started, that we got the bright idea that maybe we could use social media to try to contact and locate participants as we went along. So you can go to the next one. To the next slide.
Yeah, I got stuck for a second. Hang on one second.
Yeah, I'm stuck. I can't understand why I'm not able to drive, but so like I said, we introduced it after study launch. 3 of our 10 sites participated, and we're right now collecting data to understand why only 3 of the 10 sites participated, but that was fine. You know, it was something that we kind of added on with as we were going, and so we wanted everybody who was able to do it. Some of the feedback that we've gotten was that people were not giving their emails in the locator form, so they figured if they didn't have email, they certainly wouldn't have access to social media. So 3 of our sites participated. They applied for IRB amendments and made changes to their consent forms. And they started requesting social media contact information from newly randomized participants because we were still in the randomization phase, and then all participants who returned for follow-up. We really gave sites the flexibility to implement this as they chose and as they were able to do so within the whatever the confines were and the rules of their different treatment programs. So there were some programs where they were not able to access Facebook on site, and so they needed to find a way to do it off-site that was comfortable for the research assistant. And then there were other places where there were already some rules in place of how to use social media, so they abided by those. So we really let people do what worked for them to get the thing going. So our data collection is ongoing since we will be collecting data through June, but as of the end of the year, because then we started submitting some posters related to this data. Here's some data that we collected about who gave us email information and text information and how effective it was to reach them. So out of our 510 participants, we collected email information and text information from about half of the people. The attempts were made with about 40% of those using either email or text. I think most of our sites, our research staff, their first line is to reach out by phone, but about 40% who had access to the email and text data used that. And then successful contacts were made about half the time using email. So a successful contact was that they got a response, no matter how they got the response, they got a response by virtue of using that method. So about half of the people responded based on an email, but almost 3/4 responded based on text. So this is some good information. If you're not asking people, if you can text them reminders, it's a good thing to be adding to your protocols because it can be very effective. And I know just with my kid and with talking to other teenagers, so these are teenagers, but also talking to other researchers, and from what we know about how people are starting to communicate, a Facebook notification and a text message are starting to get a lot more attention than an email, because we are all getting inundated with email, and people are paying less attention to email and more attention to other ways of communicating. So this is good information. And then the next slide shows some of the preliminary results of our using Facebook. And this is broken down by the 3 sites and overall, and there were some differences in terms of the sites. As you see, one of them, almost 2/3 of their participants agreed to be contacted using social media, and another one it was just 1/3, and another one about 1/2. And we were able to reach out to some more people who we might not have seen by virtue of using social media to do that. And there was some variability, as you can see, by site. But about half of our attempts turned out to be successful. And some of the reasons that people did not agree to be contacted via social media, about 1/3 of them didn't use social media or had no computer access. Some of them refused, and then in some cases the staff just wasn't able to obtain the information. Okay. So some of the lessons that we learned is that basically Facebook was a good tool for searching for and locating participants. Certainly staff buy-in and systematic guidelines are essential. So we basically told people to use social media as they saw fit. Some of them were using it systematically as another type of contact, but mostly it was used as a last resort. So if I can't reach them by email, if I can't reach them by phone, then I'll try to find them on Facebook. So by integrating social media into your standard practice, we might be able to increase our follow-up and locating efforts even more by making that just part of our regular toolbox that we use in our contact attempts. And always, as we've been saying throughout, it's important to set up your profile to maintain that level of confidentiality.
Gloria, I do have a question. Stacy was asking, would it be possible to get a copy of the guidelines the sites have used? And I can certainly distribute the CTN social media guideline. It's already up on the CTN dissemination library, but it's no problem at all. I'll post it up with this recording of this webinar on the CTN dissemination library, and in addition to that, I'll email out a copy of that to everyone who registered for this session today.
Thank you. But I'm wondering if Stacy is also asking for specific guidelines that our sites use for social media. And we are compiling those right now. So I'll have to get back to you on that.
Okay, Gloria will get back to Stacy. If anybody has any questions, you can go ahead and press *1 now. Erin, did you have anything else that you would like to add?
Not right now. Thank you.
Sure. And just while we're waiting, if there's any questions that do accumulate, everything will be put up on the CTN Dissemination Library, and this gives you a quick notice to how to access some of the training information. You may have to scroll down a wee bit just to get to the webinar information, but there's a very good library of webinars there accumulated now. And also, the next webinar will take place in May on managing emotions in recovery. So I encourage everybody to mark their calendar. About 4 weeks before that webinar is scheduled, we'll send out an email invitation for people to start registering. And I want to thank everybody for joining. I, again, thank Erin and Gloria for presenting today. It's great information, very timely information. If anybody has any questions, after the webinar.
Ms. Buttrey, we do have a question coming in on the phone.
Sure, go ahead.
Coming from Valerie. Please go ahead.
Hi. Oh, gosh, I just forgot what my question was. I was wondering two things. One is whether we could get copies of the slides from the prior social media sessions that have been held.
From the previous session in January? Certainly.
Is that on the CTN website?
It is. It's on the CTN Dissemination Library. If you go there, the slide set is there, and the recording of that webinar is there as well.
Terrific. And the other thing I was wondering is, since this is relatively new practice and IRBs may, because of new practice, be somewhat uncomfortable with it, are there, when you post these sort of practices or language or guidelines that have been used in other places, is there some sort of standard that we can cite as, sort of common practice or practice suggested by, the dissemination network, or is there some reference we can give our IRB that may help to reassure them?
Right now, I think it's really individual IRBs are coming out with that information. As soon as our IRB comes out with something like that, I would be inclined to share it. There is an organization that is one of these external IRBs called Quorum, Q-U-O-R-U-M.
Could you repeat that?
Yeah, Quorum, Q-U-O-R-U-M.
Okay.
So if you search Quorum IRB, they're one of these external IRBs, and they recently did a webinar about some of this information. So that could be something to cite, since they are an IRB. So one of those IRBs, you have to pay for them to review your stuff. But they recently did a presentation on this topic, so that might be something to look into. But we're just kind of waiting for official word as it comes out. If anybody knows that their IRB has come out with that kind of guidance, that would be some great information to share with the network.
Yeah, and on the information that you post, that you're going to post, does that include any sort of language that you've used in your consent forms that might be, that we could sort of go by, that has been sort of successful or strategic language that is good communication for IRB?
Let me look into putting that together.
Okay, that would be extremely useful.
Yeah.
I know there are a lot of us struggling with some, recent tightenings in IRBs, and trying to be as clear and communicative as possible while not hanging up our research is always the, the obvious concern.
Yeah.
Thank you.
Mm-hmm.
And we do have another phone question coming from Albert. Please go ahead.
Hey there. Thank you. Gloria and Erin, this is really an informative presentation, really helpful. I mean, I feel like a dinosaur. I still like to read the newspaper and stuff. One question I have is about telephone communication. I get reminders, automated reminders from my dentist that sort of cues me to either indicate that I'm going to either make my appointment or reschedule my appointment. Do you guys see any problems in using that with our populations?
Yeah, maybe. Yeah, I think it depends what the communication is. You know, even if you leave a message for someone, if you're calling from a research study and you leave a message, it's typically something that's quite vague, right? Because you don't know who can also access that information. So those kinds of automated responses, I would be careful with, and something that, again, maybe throw by an IRB if you have a specific question and want to use a technology like that for outreach. But I would be concerned about that.
Okay. I appreciate that.
Devin Berry at the University of Cincinnati has done a lot of research. Now, he doesn't work with substance abusing populations, but he does work with some mental health patients, and he's used Google Voice to do some of that sort of thing for his study participants. And again, you'd want to get it through the IRB. You'd want to keep it generic, but just sort of send a generic text message. If they know that they're supposed to be in touch with John and you say something generic, like, I just want you to remember your appointment with John tomorrow, then those are the sorts of things that it's in the public domain. One thing that we did find out is that if you are using services like Google Voice or their ability to text through that information is stored, the text message may be stored on a third-party server. So that's why you want, and that's not secure. Now, if you are at a facility that has the capability to do that kind of text messaging and have the storage on a secured site, then that's a little bit different. But so just keeping that in mind, that would be one of the key factors, is whether that third party's website is secure, and then what kind of content do you want on an unsecured server.
Thank you very much.
And there are no further phone questions at this time.
Great, thanks very much. All right, once again, thank you, Gloria, and thank you, Erin. And thanks, everybody, for attending today. Again, this session will be put up on the CTN Dissemination Library. And if you have any follow-up questions, don't hesitate to get back in touch with us. You can contact everybody if you contact ctntraining@ms.com, and I'll make sure it gets through to Erin and to Gloria if you had any follow-up questions. That concludes the session for today. Thanks, everybody. Have a great afternoon.
Thanks so much. Bye.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.